Boston, in his own backyard, was bitten by a snake. He ended up in hospital with us for about a week, was in an induced coma on a mechanical ventilator. Yeah, he was. And luckily he did really, really well, and we managed to get him home, but not all cases go as well as Boston. So first most important thing, are you listening, sir? Yeah, okay, we're listening. Do not go near the snake. If you see one in your backyard, if you see one out walking, don't approach them. We don't want you getting bitten or anyone else getting bitten, and it may even get your pets into protection mode where they might go and get another bite. So super, super important not to actually approach the snake. We've got some amazing snake catchers down the peninsula, and I'm sure all throughout Australia. So if you do notice a snake in your backyard, immediately call the snake catcher and they'll be able to pop out and really, really safely take that snake away, and also potentially help you identify it, which will help us as well. Now, if your pet does unfortunately get bitten and you witness it, the biggest, most important thing you can do is get your pet straight in the car and straight to your nearest vet clinic. We really, really like if you give us a quick ring beforehand just so we can get things prepped, but if not, because it can be quite stressful, then just make your way straight down to us. The sooner you get seen by a vet, the safer it's going to be for your pet, and the more likely they are to have a really, really nice prognosis, just like Boston. There are situations where you can get what's called a dry bite, so your pet gets bitten, but the snake doesn't actually release any venom. But these are actually quite hard to diagnose. Yeah. So we tend to still kind of do all of our testing, still keep an eye on them for a minimum of 24 hours in hospital to make sure they don't develop any signs. You might notice your pet kind of yelps or vocalizes. They can then immediately collapse, followed by vomiting, and then they kind of recover and seem okay. When this happens, this can be a sign of a lethal envenomation. So even if your pet looks like they have been bitten and they've recovered well, we still recommend you coming straight down to us. Now, unfortunately, sometimes what may look like a brown snake or a tiger snake or a copperhead actually could be something completely different. But it tends to be less important that we figure out what the snake is, and more important that we start treatment as quickly as possible. Different snakes carry different venoms, so certainly some snakes will cause muscle damage only, other snakes will cause muscle damage and stop the body's ability to clot, and then other snakes can actually cause muscle paralysis, and this was the case with Boston. This is why it's super, super important to immediately see a vet if you think that your pet has been bitten, or if you actually see that your pet has been bitten. But really, the only big first aid advice that we can give if you think your pet has been bitten by a snake is immediately in the car and straight to a clinic. Unfortunately, dogs tend to be extremely curious and very protective. So yes, call us, call your GP vet, and we'll be able to give you advice. Now, as far as prevention and how to stop it happening, if you live in an area that is near bushland and near water, that tends to be a snake area. Certainly get in touch with the snake catcher local to your area, and they'll actually be able to advise you what snakes are around and potentially even help you with setting up wiring or protective areas that can prevent the snakes getting into your backyard. But again, if you are in an area that's endemic to them, best to just be very, very vigilant. So short leashes, away from long grass, away from bushy areas, and if you are in an area or you're on a property where you've seen snakes before, get in touch with your local snake catcher, get some advice, and don't let your pets out by themselves, certainly not during the heat.